If you've got a pet, and I'm sure you already know about this one, typically at the worst time, something happens, you need to get them in to see a veterinarian. But due to circumstances financially, it's just really not the best time at all. Well, in today's episode, Dr. Virginia Mule joins me. She's a senior medical director of Emancipet. Now, Emancipet is this nonprofit veterinary organization founded in Austin, Texas, my home, by the way, that is rapidly expanding to multiple states. And they may just be a solution for you to make sure your pet gets the best care. Now, Jenny, she talks about where they started and the wonderful veterinary care they provide today. Now, I'm talking spay and neuter, general veterinary care, dental, and just a lot more. And from my experience, and I'm sure yours too, oftentimes, due to financial burdens, it's sometimes really difficult to make the best decision. And that decision, it really does affect the pet, the veterinarian, and you as well. Now, Emancipet's model basically challenges the traditional veterinary structure. They streamline everything, focusing on efficiency, transparency, and community trust. And by doing so, they really cut the cost significantly. Now, we talk about the economics of quality, yet affordable vet care, and just so much more. Now, you may not be in your area, but here's something that's really cool. They've got this training institute model where they work with other clinics to help them institute what works for the clinic and for the pets and their owners. Plus, they're expanding so fast, they may just be in your area pretty soon anyways. They really, truly are this amazing organization. And Dr. Mule, she's just this wealth of information. So, if you want to find out how to get the best care for the least, this one you really want to listen to. And guess what? Your best friend is going to really want to thank you for it when you do.
For real, 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 for real. Got a bunch of furry friends and I love them all the same. I'm an animal lover, veterinarian is the name. Let's share some pet stories from heartwarming to strange, losses and gains, from wacky to insane. For real. You're now tuned in to For Real with your host, Mark Kyle.
Hey, everybody. Welcome back to the For Real podcast. Today, I have a local group that I really wanted to have on the show. I'm really excited to do this, but my special guest today is Dr. Virginia Mule. Dr. Mule, welcome to the show.
Hi, Mark. Nice to see you again.
Well, I'm glad you're here. And like I always do in most of my episodes, is I like to talk about you, your journey, you know, how you got where you are. And then we're going to get into Emancipet because I know you guys have spread out to a bunch of different states. But of course, living in Austin, I'm very familiar with, and I know what a wonderful job you guys do. But let's talk about you. Let's talk about you growing up, how you got here, how you got to Austin and all that stuff. And I'm going to pass the baton to you and let you do your story.
Awesome. Sounds great. I grew up on Long Island, New York. Always wanted to be a veterinarian since I was a little kid. And so, after veterinary school, I actually ended up working in West Virginia. It was just kind of a job that came up that sounded interesting to me. And it was a general practice. And it was really cool because I got to see small animal patients. I got to do some emergency work. I got to see birds. I got to treat wild birds and rehabilitate them. So it was a really varied experience. And my goal was always to help animals. So I was like, okay, let's see how many different types of animals I can help in one setting. So that was a really, really great educational experience coming out of school to sort of learn just the variety of things. But something that I saw every day and had a lot of struggles with was just this divide of pet owners that could afford care and pet owners that struggled to afford the care that we were offering. Just being forced to make some of these really heartbreaking decisions, not about what they wanted for their pet or their love for their pet, but about what they could afford for their pet. And that really stuck with me. And I saw, I struggled myself and I saw a lot of colleagues wrestling with that fact. We all went to vet school because we wanted to help animals and help people. And then having to deal with the monetary part of it was a real moral and ethical struggle for a lot of people. And I think that's why so many veterinarians are leaving the profession. There's plenty of other reasons too, but I think a lot of people it's not what they actually wanted to do when they went to vet school in terms of, talking so much about money and having those barriers.
Well, it's one thing because I've worked in the human side and the animal side, and what I always tell people, it's really a pleasure to work on the animal side because generally, and I would say 99.9% of the time, the veterinarians, which are medical professionals, are really in it because of their love of the animals. A lot of people on the human side are in it. They may love science, but they also like the money that's involved with it as well. And I always find that it's such a pleasure to be on the vet side to do that. By the way, as we're talking, you guys listening aren't seeing the video, but I'm talking to somebody who's got a cat in her lap. Number
Of
one.
course. Can't do a podcast without a cat in your lap.
Yeah, there you go. And the other thing is, I was thinking, so Virginia was in West Virginia. Did you get that a lot when you were there?
Yeah, and a lot of people ask me if I'm from Virginia. They think maybe my parents named me after the
That's
state.
funny.
But it's a family
Well,
name.
it's funny here in town. I have a lot of friends. We're in Austin, and for everybody listening and that didn't know, but I have a lot of friends that are named Austin. It's always kind of weird, Austin and Austin. It's kind of funny.
Yeah. Yeah, we get a lot of dogs too named Austin at our
Yeah, I
clinics.
bet. Okay, so you're looking at that, and one of the things that I'm very well aware of is the cost of veterinary medicine, and what you said and what you alluded to, I think is a really important thing to think because there are people out there that one can't afford it. Two is they're not making the best decisions for their animals because they can't afford it. And they have to do this thing. Can I do this? Can I not? And then on the other side, which a lot of people don't realize, you've got a person that loves what they're doing, but there's a cost involved unless they have a program like you guys have. So it's a dilemma in the end of the day of how do you what's the solution? And I'm guessing that's what brought you there. So let's go back in time a little bit. You're in West Virginia, and let's go get you here, and then let's talk about all the cool things you guys are doing.
Yeah, absolutely. So basically, after about a little over 2 years in West Virginia, my then boyfriend, now husband, was graduating with a PhD, and he got a job offer in Austin. And one of the cool things about being a veterinarian is you can find a job anywhere. Any major city is going to have veterinary jobs. But having been out for a little over 2 years at that point, I started thinking like, okay, what do I actually want to be when I grow up? What do I want to do?
Hmm.
And how can I still enjoy my profession, enjoy my job, but not have the same stresses that I'm dealing with about financial concerns and some of the other things that I didn't love about general practice. So I saw a job ad for Emancipet, and I thought, well, that sounds pretty darn cool.
Yeah.
This whole idea of being able to provide low-cost care at a high volume to as many people as we can and to serve pets and families. And I had always thought that maybe I wanted to work for a nonprofit in the end because I just really believe in giving back to the community. So it felt like the right time to make that change. So I applied for a job as a staff veterinarian here in Austin, and I got the job and learned all sorts of fun things. And over the years, I've basically just worked my way up through more leadership roles as a way of trying to expand my impact and dive even deeper into this sort of access to care movement.
Well, one thing I want the audience to hear too, in the U.S. there's about 4 or 5 that are really the top schools, and of course, if you're in Texas, everybody thinks it's Texas A&M, but you went to Cornell, which is also one of the top schools too. Just as FYI, the good thing about being here is you're not Virginia and Virginia, you're Virginia and Austin. But let's talk about Emancipet and let's kind of go back in time because I know it's been here for 20 years, 19, 20 years or whatever it is.
26 years, going on 27.
26, wow.
1999, yeah.
That's easy to remember. And so 1999, let's kind of talk about back in the days before you were there. And then let's kind of move forward in time and how you guys have progressed. I can tell you guys for the listening that I know several people that have been able to use Emancipet for a variety of reasons, and I've never ever heard anything but positive things about it. So let's start back in time and let's kind of take it to where you are now and where you're going.
Yeah, so Emancipet was founded in 1999, and at first the goal was mostly just providing spay and neuter services to underserved communities. So it was a mobile surgery bus, and they went out into the communities, and I believe it was a contract with the city of Austin to, get partially reimbursed for some of these procedures. And the whole idea was mostly about a little bit more about animal population control and just getting the very basics of spay neuter into areas that didn't have access. And from there, it's really grown into a much bigger mission of we basically just believe that cost should never be the reason that a family goes without care for their pet. So we are always trying to expand what services we offer. So we started looking at what else could we do. We started doing more vaccines for those spay neuter patients, and then we realized, well, we're giving them the first set of vaccines, but they might need boosters, and if they're not getting another surgery, they're not coming back for those. And that was how we started to open some of our actual physical clinic locations and offer what we call HPS or Healthy Pet Services, which is focused on preventive care. It's your annual exam so that you can get heartworm prevention. It's heartworm tests, it's vaccines, and all of that stuff. Again, just trying to offer it at a really high quality but a really low price so that people can afford it and they can keep their pets healthy and hopefully prevent those expensive issues from coming up later. And so fast forward to today, we've expanded that even further, where now we offer spay and neuter, we offer heartworm treatment here in Texas, we offer those healthy pet services, and we just recently opened our new Austin and Dental and Surgical Center just about 2 years ago now, where we're focusing more on providing high volume, high quality dentistry for pets, because we realize that, most pets need more dental care than they're getting because the cost of that can be so high. And we also offer what we call special surgeries, which is just soft tissue surgeries that aren't done at our spay neuter clinic. So things like mass removals, amputations, GI foreign body surgeries, all sorts of different things that we can offer, still upholding our quality standards, but at a lower cost because of our nonprofit model.
Well, I'm going to expand a little bit. So I know on your website, you guys, by the way, and I would recommend anybody going to the website, and we'll get to that here in a second, but you've got a great video. And I think that the title of the video really defines a lot of things, because it has a double meaning. And the title is No Companion Left Behind. So, of course, we're talking about companion animals, but animals are also our companion as well. And what I really think that really rings home for me, at least when I watched the video, there's some homeless people in there that have for weird situations. They're in a situation where they still have their dog or their cat or whatever, but they're in a homeless situation and they want to take care of their best friend and they can't afford it. And that's what you guys are doing more. So, I mean, you're going across the board, but those stories are kind of those heart-wrenching stories that everybody wants to hear about. So let's talk a little bit about the kind of people or the community that you're able to serve so people understand, because it's a broader thing other than, okay, instead of spending $300 at a vet clinic or spending $100, it's way more than that. Let's get into, the emotional part of it and what you're able to do.
Yeah, for sure. So one of our core beliefs is that people want to do what's best for their pets. And so our goal is to serve everyone who walks into our clinic in a non-judgmental way. There's no income qualifications, so we do have a wide range of clients, from people who are maybe just a little bit down on their luck and can't quite afford that full service, private practice vet bill, but are, able to afford our prices, to people who come in maybe with a situation where they've become unhoused or have lost their job and they might not be able to afford anything. And the important thing to us is that every pet is going to get the care it needs in that moment, regardless of that. So we sort of balance it out by having people come in who can afford things. We ask them, everyone at checkout is asked to pay it forward with a donation if they're able to. And that helps us subsidize the cost of potentially discounting the products even further for people who can't afford it. So, I mean, there are just, hundreds of people every day being seen at our clinics. And, some of them, this is literally the only way they can keep their pet because they're going to get kicked out of their apartment if they don't get them spayed or neutered or vaccinated. And then others, it's just a way of them maybe being able to save up a little more money in their savings account for when there is an emergency. And we believe that it's important for everyone to have access to that care. So yeah, that's kind of the core of our mission, is non-judgment.
So I'm an analogy guy. I'm a big kid at heart, right? So the way I look at it, the way I explain it to people is this. So, first of all, these days, especially in Austin, it's really expensive to live here. So, when you're talking about people that can't afford vet care, that could be because they can't afford to pay for their house because the housing's so expensive here. And even if you go out and get a hamburger, it's not that it's not that cheap anymore either. So, it's kind of like you've got a car. And the way I look at it, you need an oil change. You can go to the dealership, which is kind of what all the other clinics model is, right? They're the dealership. Or you can go to Jiffy Lube and you're going to pay half that price, right? And Jiffy Lube gives you just as good of a oil change as whatever the Ford dealership. So you're able to do that. So you're able to do that. And one of the things when I was kind of doing my homework for this thing, you guys, let's talk a little bit about your model because your model is the way I read it, and tell me where I'm wrong. And actually, if I'm right, explain it better. Is you've learned how to do more numbers that are more efficient. So you guys are of well-tuned machines. So walk through how you guys are able to do that, and also job burnout as well.
Yeah, for sure. So basically, we operate under what's commonly called the high quality, high volume spay neuter model, at least for our spay neuter surgeries. And this is not something we invented. It's something that has been in the veterinary industry for some time and has grown.
Hmm.
And basically, what it is, it's a set of surgical techniques. Our doctors go through a rigorous training process, one on one with another more experienced veterinarian to learn these techniques. And it's all about doing fast, efficient, and safe surgeries. So we're making smaller incisions than what you're taught in vet school. And we're doing a lot of things by feel and a lot of things, just by muscle memory, to be quite honest. And these surgeries are incredibly safe and incredibly
Sure.
fast. And it allows us to almost do it like an assembly line. And I mean that not in a way that pets aren't being treated as individuals, but that everybody knows their role. We have a team of technicians who are highly trained, and this one is working on getting all of the pets anesthetized and putting them on the table for the surgeon. The doctor is going over there, doing the surgery, turning around to another table, and there's another pet right there, and they're going to do that surgery, and they're just bouncing back and forth. And then we have two other technicians supporting it, one on the recovery mat, making sure everyone wakes up safely, and one who kind of floats around and helps with a little bit of everything. And it's in that way that we're able to do, 35 surgeries in a day for our more experienced surgeons. And that's one of the ways we keep our costs low. The other thing is we're so fast at the surgeries that the risk for the pets goes down a lot. Anesthetic time is one of the biggest risk factors for infection and just for general complications. And if we're able to get them on and off the table in 10 minutes, there's a lot better recovery. There's a lot faster waking up from anesthesia and fewer complications. And we track those complications rigorously. That's actually part of my job, is making sure that we're maintaining the high quality part of high volume spay neuter. And then for our other services that we offer, we kind of have taken that idea and put it into place in those. So our vaccine appointments are very quick. The technicians are very good at going through all of the recommended services in an efficient way so that the owner can, pick what they want to do for their pet. The doctor comes in, does a very focused exam on that pet, answers any questions while multitasking, and kind of gets it all done. And basically we're spreading that now to our heartworm treatment, special surgeries, and dental models as well. And the special surgeries and dentals are still a little bit more under development because, as far as I know, no one else is quite doing them the way we do them at that clinic. So we're sort of inventing that as we go. But it's going really well, and it's really exciting. And then you talked about burnout, and I think, there's definitely a personality type for people who like to work at Emancipet, and we're generally people who don't want to sit still. And I think the reason, burnout is real in any part of the industry, and I'm not going to say that no one who ever works here has gotten burned out, but a lot of us feel so fulfilled by the mission and so happy that we don't have to say no to people because they can't afford services, that it's a long, tiring day, but then you go home and you sleep well at night because you just helped spay and neuter 35 pets, or you just vaccinated 100 animals on a busy summer day. And that's the way I think about it, at least, and that's the way I get fulfillment from the job and reduce that risk of burnout, is just knowing how many people and pets I've been able to help.
For real, 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 for real.
And we'll be right back. This episode is brought to you by Emancipet. Now, Emancipet is a nonprofit organization on a mission to make veterinary care affordable and accessible. Today, there are over 60 million beloved pets across the country whose families cannot access or afford veterinary care. Now, with your help, we're changing that, and you too can be paying it forward for a pet family today at emancipet.org/donate. Again, that's emancipet.org/donate. So I have a story for you that's related to this thing. But I was thinking first off, and I'll get to that story is, there's all these mission trips where people like veterinarians will go to a country that needs spay and neuter, and they're able to do, I don't know, I'm going to say 100 animals or more a day because they've streamlined what they're doing. And so the story, and so that makes sense if you're focused on one thing and you're doing that. So it's spay and neuter day or whatever the thing is. So I'll give you a story. This was actually at a very good vet clinic. I won't say their name. I've always had rescues. At that time in our life, we had a pretty decent sized property, and we probably had 6 dogs or something. We were, those guys were dog hoarders. Anyways, one of our dogs we took in was a rescue. We took her in to be spayed. She goes in, we pick her up. She's got the scar, all that kind of stuff. And about 6 months later, I'm going, that dog's pregnant. So sure enough, we take her back. And what had happened, she was pregnant. What happened is the vet, again, very good vet, was doing the surgery and got pulled away to do something else. And they closed her up without doing what they should have done. Now this is a big mistake, but the reality is that I think the way I'm envisioning it, and correct me where I'm wrong, is that if you're focused on one thing, your time's going to go down slower. The whole anesthesia thing makes all the sense in the world, but you're doing the one thing, so you're an assembly line, but where you're very specialized in whatever that part of the thing you're doing, so you're able to do that. So that makes a lot of sense to me.
Yeah, it's all about the focus. And many of our doctors will say, like, when we start doing surgery, it's almost like a meditative state. Like you're not even really like thinking, you're just reacting, and you're in this flow state where you're just going from table to table and, removing the uterus or removing the testes, depending on which pet is in front of you. And
Right.
and I think it's that focus and that lack of being pulled in a million directions that helps us get it done safely and effectively.
Right. Now, one of the things I read about you guys, so you are expanding. Let's talk about your expansion. And then I want to also go into your training program that you're doing with other clinics, teaching them how to be more efficient and low cost as well. So let's talk about your expansion, and then let's go into your training program as well.
Yeah, so the expansion over the past several years, we've opened up new clinics, really going back over a decade now. We've expanded into new areas. So like you said before, we started here in Austin, Texas. We've now got 3 clinics in Houston, Texas, and 2 clinics in Philadelphia. Something that was new in the past few years was we opened 2 clinics in PetSmart stores where there used to be other veterinary clinics in-house, and those spaces weren't being used, and we were able to partner with PetSmart to open Emancipet locations. One of them is in Houston, our Northwest Freeway clinic, and the other one is in Philadelphia, our Roosevelt Boulevard clinic. So that's been kind of a new way of looking at how do we function inside of a retail, pet store, and how does that work? And overall, those have been going well and starting to build up their numbers. We expect every clinic to take time to get to sort of what we consider profitable, obviously, because we need to be in the community long enough for people to come see us. But those clinics are doing well. And then we have our new dental and surgical center, like I talked about. And our dream and our goal is in the next several years to be able to open more of those dental and surgical centers. Once we feel like we have that down pat and we know exactly how to run a clinic to do those services, we would like to offer all of our services in all of our regions. So get more clinics in Philadelphia and Houston, get more dental and surgical centers everywhere, and then look at expanding to new cities and new places where people don't have access to vet care. We're very big, though, on building up this foundation where we are right here. And then once we feel good about it, expanding those services.
So you're building a model. So I know here you've got brick and mortar, but you also have mobile clinics as well.
Mhm.
So talk a little bit about that. And are you do? And my other question is how do you go from Houston to Philadelphia? One, but two is are they brick and mortar or are they mobile there? How's that work?
So right now our only mobile clinic is in the Austin area, although that's another thing we would like to change. We would love to get more contracts. We're very lucky to have a partnership with the city of Austin and Travis County to run most of that program. They cover a lot of the services, and that's why we're able to offer a lot of things for free on our mobile unit. So we definitely want to expand that to other areas as well. Um, Houston was actually after Hurricane Harvey was how we ended up there. We went there sort of just to help with all of the pets that were around and realized that we could open some clinics and that our services would be needed. And then I wasn't involved in the Philadelphia move, but my understanding it was a partner organization that wanted to fund a spay neuter and wellness clinic in Philadelphia. And they reached out and kind of invited us specifically because they knew that the work we were doing down here was really good. So it's kind of an odd mix of cities. But it's fun because you get to have the flavor of each city at each of the clinics. And what's really cool about our model, speaking again about the assembly line, is like for the most part, if you walk into an Emancipet clinic in Austin, up in Killeen, out in Houston, or in Philadelphia, you're going to get almost the same exact experience, just colored maybe a little bit by local personality and all of that. So it's a really predictable, repeatable thing we're going for.
I just was thinking while we were talking. There's a woman here in Austin that was really instrumental, the patron of you guys, right? What was her name? Because I was lucky enough to go to the Emancipet Gala several months ago as a guest of somebody, and she was there. What's her name? I think we need to give her credit first of all. Do you know her name?
Is it Missy that you're thinking of? Missy McCullough?
Yeah.
Yeah, so Missy McCullough was involved with Animal Trustees of Austin. There we go, ATA.
Okay.
So she was big in founding this other organization that eventually merged with Emancipet. And she was actually, her organization was doing the heartworm treatment and those special surgeries and those dentals. And that was how we were able to sort of absorb what she was doing there, build a bigger, stronger organization by combining forces, and then now expand those things to be doing them at higher levels and higher volumes than was going on with that organization. So she's instrumental in terms of fundraising and awareness for just generally animal welfare in the Austin area. She's kind of a legend.
I always find women are so much better than men. They're just stronger. They get bigger hearts. They really do.
No comment.
No, you can disagree. You can agree. So, I always find it's really fun talking to female vets. Our women usually are behind the really cool things. I always think so. I say that about my daughters for sure. But it's really kind of a cool thing. One other thing I know, by the way, I have to apologize. I should have told you, and people who listen know this. I bounce all over the place because of the way my mind works. I want to go back to dental. So one of the things that I want to make sure that everybody that listens, if you've had an animal, more than likely you've had dental work. The crazy thing is that most people don't realize is how much dental work is really involved in veterinary. I have the opportunity to be in vet clinics all the time. And it's almost like you guys are more dentists than you're veterinarians because you guys do a lot of dental work. So talk a little bit about that. And then I want to talk about if I'm a pet owner that whatever financial reason I want to go see you, whatever that may be, walk me through how that process works.
Yeah, for sure. So
but let's talk dental first.
Yeah, for the dentistry part, you're right that, both at Emancipet now and even in general practices like dental health, I think it's kind of the next big wave in realizing ways we can serve our animals better and preserve their health. Part of this is that our animals are living longer now, and they're living long enough for their mouths to get pretty gross and for them to have enough dental disease that it can actually affect other parts of their body. So one of the issues with dental disease is that not only is it painful, it's uncomfortable, they have real stinky breath, all of those things that we can see and experience. Maybe your dog doesn't want to chew on harder food. But there's also a problem because all of that bacteria and inflammation in their mouth can go into the bloodstream and go to other organs like the heart, the kidneys, the liver, and cause problems there. So that's one of the reasons we've decided that even though a lot of our focus is prevention, like we kind of include dentistry under that umbrella now because we're preventing other stuff by treating the teeth. And so what's interesting about pet dentistry, obviously, is you can't tell them to open their mouth wide and say, ah. So we do have to put them under full anesthesia in order to use the ultrasonic scaler to get all of that stuff off of them. You'll see some people, some places will offer dentistry where it's maybe a technician who's just chipping away at their teeth when they're awake. And while that can make their teeth look better, and I'm not going to say it's necessarily bad for them, you're not getting under the gums, you're not getting that deep clean that you might get when you go to the dentist.
Right.
Because if you try to do that, the dog is going to bite you or close their mouth or just otherwise not appreciate it.
My dog would bite you for sure. My dog's biting you.
Exactly. So we anesthetize them. They get blood work first. They get full mouth x-rays, just like you have to get x-rays when you go to the dentist at least once a year to see what's going on under those gums and to see which teeth are unhealthy. And then unfortunately in pets, a lot of it ends up being extracting teeth. And there are people who, get worried about that or upset with the idea that their pet is losing their teeth. But first of all, I can promise you no vet is going to extract a healthy tooth because they're really annoying to extract and we don't want to do more work than is necessary. And your pet is going to feel so much better. If those teeth are diseased enough that we want to remove them, they were causing discomfort or they were going to very soon. It means that the disease was far enough that those teeth needed to come out. Then we clean and polish all of the other teeth with the hopes that if you keep coming back, on a yearly or even biannual cadence, that we'll get to save the rest of them. So we get rid of the ones that are diseased and then we try to preserve the rest by doing that cleaning, giving you instructions on home care, dental treats, teaching your dog to brush their teeth, all of that good stuff. And I think it's a really important part of pet health, and it's just expensive, in a general practice setting when they're not having lovely donors and the high volume model to support, getting a lot of pets through it. It just gets expensive to do those treatments.
Well, your mouth, which most people don't realize, we can talk offline about this. There's a friend, somebody I've had on the show that's a microbiologist who created a product because the microbiome in your mouth affects everything. And so basically if your pet needs it because they're smelly breath or whatever their deal is, and they do a deep cleaning, at that point, it's almost preventive care for all these other things that are there too. It's not taking care of the teeth. It's actually a preventive thing.
Yep, exactly. It's kind of the start of all wellness is in the mouth in a lot of ways.
Yeah, exactly. That's why we want to brush our own teeth, and that's why we teach our kids to brush their teeth.
For real, 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 for real.
And we'll be right back.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
I'm in Austin, Texas. I need to get shots. I can't afford to get shots. I need flea medicine. I see a loose tooth. What's the process to work with you guys in all your different locations? What do they do? How does it work? I know you said you guys don't check their financial qualifications. So just kind of walk through the process for the guys that are listening.
Yeah, so the first thing I recommend is to go to our website, which is www.emancipet.org, to see which clinic is closest to you, because we do have multiple clinics in the Austin area. If you live in Austin or Travis County and you need free services, if you're, not able to afford much of anything, our Austin Free Day program goes out Fridays and Saturdays to different parks in the Austin area. So we're able to offer no cost for the office visit, no cost for the rabies vaccine, no cost for the microchip at those locations. And if your dog is under a certain age, and I'm not going to say it because I'm always wrong about what age it is, they also get a free distemper vaccine. And that's all covered by that contract with the city of Austin. We also offer our other services at normal prices at those clinics. So that's one thing to look at, is figure out which clinic. If you're going to one of our brick and mortar locations, something we're pretty excited to offer now is online appointments. So we used to be an entirely walk-in model where everyone had to sign up at the beginning of the day, and we'd text you later off of a restaurant waitlist software to let you know. And we still do that. We still offer walk-in services, but we're now offering afternoon appointments on weekdays for people who maybe can't afford to spend 5 hours waiting for their services all day. Yeah. So if you want to say, I want to come in on 3:30 at 3:30 on Tuesday, you can make that appointment, and we're going to get you done within a reasonable amount of time of that appointment. So that's the sort of entryway to getting in. You can also make spay-neuter appointments online, so you don't have to come in for a wellness visit first to get your pet spayed or neutered. They will be examined that morning when you drop them off for their procedure, and the vet will call you if there's anything that makes us concerned about proceeding with surgery. So that's kind of the start. If you think your pet needs dental care, going in for those healthy pet services, our doctors will look at their mouth and sort of grade their dental disease in the computer, and then they'll tell you how to make an appointment for that service. That one, we do ask that you come in first to get that exam, just so that we know how to book it, because obviously there's a very big difference in terms of timing of a dental procedure for a patient who doesn't need any teeth extracted and a patient who needs most of their teeth extracted. So we kind of balance each day to not include too many of the very difficult ones, and make sure our doctors can finish in time, and everybody's safe and under anesthesia for appropriate amounts of time.
So one of the last things, you are also working with other people to teach them how to do your system. And the reason why I bring this up, and I don't know if you're doing that or not, because there are a lot of people that aren't from Austin or Philly that are probably listening to this episode. Let's say you're in another city and you want to get a program going on your end, or you want a clinic to learn how to work more efficiently so you can bring pricing down. Is that something, the thing you guys are doing? I know you're doing some training, but is that within a specific area, or is that anywhere that anybody wants to get hold of you? I'm assuming it's like a business model or something like that.
Yeah, so first of all, we're always willing to at least chat on a basic level about our services. You know, our goal is to close the gap in access to care, and that doesn't mean we want to be the only ones doing it. We want other people to learn from what we're doing and try and do those things. We do, or at least did, have a formal consulting program called the Emancipet New School. It's been a little bit shaky and on hold since the pandemic, just because of staff changes and all of the uncertainty that caused. Sure. And we also have participated in an advisory capacity with PetSmart Charities on their incubator program, which was basically for newer clinics starting to do these things. Emancipet staff were involved in advising those clinics about how to build out a model. And we're pretty big on understanding, like, our model works very well for us. And there are probably cities and towns and places where this exact model isn't what's going to work, but we would love to talk to people about what they can learn from us and what they can implement in their own communities.
Yeah, I think it's such, for you guys that are listening, I would highly recommend, if you're in a different city, because everybody's got financial issues at some point. At least there's a portion of the community that has that. And all of us probably at one time or another, to look at this model and figure out what to do. And of course, if you're in the areas that we've talked about, Colleen and Austin, Houston, and Philly, I think it's just such a great program. I know my daughter's used it for her dogs, just, from an economic standpoint. And I can tell you, I can attest 100%, 110%, any person I've ever used the program speaks so highly of it. They really do. So let's tell everybody, I know you've already said the website, but let's tell everybody how to find you guys again and get in that. And I know you guys have social media because I follow you. Let's tell everybody how to find you and all that. And by the way, everybody that's listening, that's in the description of the episode now. We're recording, but when it comes out, you'll find that too, there as well.
Yeah, so all of the information you need is mostly on our website, which again is www.emancipet.org. We are on all of the socials, so, TikTok, Instagram, LinkedIn. There's probably more. I personally am not super into social media, so I don't know all of them, but we have a pretty big presence on there, and we do post updates about our clinics as well. So for example, something that happens once a month is during our staff meeting, our clinics will open a little bit later, and we always make sure to post on social media about that so people know not to show up early in the morning. Yeah, so those are the main places to find us. If there happen to be veterinarians listening, we also, I go to a lot of conferences, and we're trying to get a bigger presence at those kinds of things too, get the word out about what we're doing to the broader veterinary industry as well.
Cool. Well, so you guys got to find Virginia. So we're kind of running out of things to talk about for now. I'm sure we could talk all day about a variety of different things. But let's get to my favorite part, which is always telling a silly animal joke at the end of the show. And I know you have one. But before we get there, I just want to tell everybody that there's listening that I guarantee you, Virginia, I know me for a fact, would really rather have a guest on telling a joke. So if you are a grandparent and you want your grandkids on, nieces, nephews, your kids, or you want to be on the show, if you email me at mkyleforrealpodcast.com, I gladly will have you on. It's always great to have kids on in particular because it's fun to hear their jokes because they're certainly a better comedian than I am. But you have a joke today, Virginia. Let's hear your joke.
I do. I tried to get my cat to tell the joke, but she got camera shy. All right. So my joke is, what do you get when you mix a dog with a calculator?
What do you get when you mix a dog with a calculator? I don't know. What do you get?
A best friend you can count on.
Oh, I like that one. That's a great one.
Yeah.
Anyways.
Credit, that was actually from one of my vet school friends. So shout out to Dr. Lauren Proctor Brown. She gave me that one.
Thank her for that. I love that one. And, first of all, thanks for participating on this. It's, I love doing these kind of things. But for everybody that's listening, really look up Emancipet, regardless where you live, because I think it's a great model. I love the fact that, you're giving quality care to these animals, because when you're giving quality care to your animal, you're giving quality care to yourself as well. So there's all that as well. And being able to make a good choice on veterinary care, I think is important. But Virginia, thanks so much for being on the show. I really, really appreciate it. I'm a huge fan of Emancipet, and I'm so glad I get you guys on here.
Yeah, thank you for having me. This is great.
Well, thank you so much. And then for everybody else out there that's listening, couple things. Please follow us on all the different social media ones. We're on all that stuff. Like us. Keep listening. Tell people about the show. One of the important things for me is, other than I get to tell everybody people are listening, and more importantly, the more people that listen, the better opportunities I have to get really good information out there, great guests and all that. So without all you guys, this doesn't happen. But most importantly, really, from the bottom of my heart, thank you so much for listening. For real.
That concludes this episode of For Real with your host, Mark Kyle. For previous and future episodes of For Real, listen via all major podcast streaming sites.
At Arizona State University, we're bringing world-class education from our globally acclaimed faculty to you. Earn your degree from the nation's most innovative university. Online. That's a degree better. Learn more at asuonline.asu.edu.